Welcome to Snohomish County's Opioid Overdose Response Training for Public Safety Partners. This training's content has been created by staff at the Snohomish County Health Department. The goal of this training is to share information and skills that will help prepare you to respond to an opioid overdose and save lives in your communities. By the end of this training, we hope that you'll be able to learn the following: how to recognize an opioid overdose and what the risk factors are for an overdose, what naloxone is and how it works to reverse an opioid overdose, and finally, how to use naloxone to respond to an opioid overdose. First, we'll start with an overview of opioid overdose symptoms and then discuss risk factors for an overdose. Knowing the signs of an opioid overdose is the first step to responding. An individual experiencing an opioid overdose will present with some or all of the following symptoms: an irregular breathing pattern, meaning the individual will be breathing in a very shallow way or not breathing at all. They may be making deep snoring, gurgling, or gasping noises. They will be unresponsive to both verbal and physical stimuli. It is recommended to loudly shout at the individual, as well as provide an uncomfortable physical stimulus, like using your knuckles to rub their sternum to see if there is any response, a slowed heartbeat or no detectable heartbeat, and skin that appears discolored, particularly in the fingertips and lips. For comparison, some symptoms of someone who is very high but not currently overdosing may include speech that is slowed or slurred, appearing sleepy though they are still awake, responding to verbal or physical stimuli, a normal heartbeat, and normal appearing skin tone. Overdoses can happen in a matter of seconds or minutes, so if someone is high on opioids, it's best to keep an eye on them as they could escalate to an overdose very quickly. Here we have an image that represents the brain and the opioids receptors inside it, which affects someone's ability to breathe. After opioids enter the body, they end up here in the brain and connect to these receptors. If enough opioids connect, a person's breathing will slow and then eventually can stop completely. This is what causes an overdose. If someone isn't breathing, serious damage to the brain will start to occur within 3 to 5 minutes due to the lack of oxygen. Oxygen starvation eventually stops other vital organs like the heart, then the brain, which can result in death. There are certain behaviors and factors that can increase someone's risk for an opioid overdose. This includes people who have a prescription for their opioid medication, but are taking it in a way not prescribed by a doctor. This may be intentional. For example, a person experiencing extra pain may take extra doses, or by accident, if they've forgotten they've already taken their medication and mistakenly take a second dose. Taking medication not prescribed to you is another risk factor for overdose. Doctors take many factors into account when writing prescriptions for an individual patient, and sharing medications with family, friends, or others may result in unpredictable effects. Additionally, taking medication that was not obtained directly from a pharmacist or doctor increases overdose risk. Many online pharmacies sell counterfeit pills marketed as common prescription medications, such as Xanax and Adderall, but have actually been found to contain fentanyl. Small children who may be curious and accidentally ingest medications or confuse them for candy are also at risk. A person who has stopped using opioids for a period of time and then suddenly resumes use is at an elevated risk for overdose. This is because their opioid tolerance has dropped during the period of abstinence, and their body can no longer handle the amount of opioids they used previously. Finally, people who use substances that contain fentanyl are at an elevated risk for overdose due to its high potency and distribution in the illegal drug supply. Additionally, people who use other substances at the same time as opioids are at an elevated risk of overdose. This includes other substances with depressant effects, such as benzodiazepines, tranquilizers, and alcohol, or stimulants, such as methamphetamine and cocaine. Now we will discuss the medication naloxone and learn how it works to reverse an opioid overdose. Naloxone is a medication that is used to reverse an opioid overdose. It may also be referred to as Narcan, which is the brand name for the nasal spray cartridge form of naloxone that is commonly used. Naloxone should be given as quickly as possible in the event of a suspected overdose. The medication is fast-acting and starts working within 2 to 3 minutes. While naloxone reverses an overdose, it is temporary, and the effects can wear off over the next 30 to 90 minutes. Each box of nasal spray naloxone, or Narcan, comes with 2 doses, meaning 2 single-spray cartridges. The medication expires after 3 years and is best kept at room temperature. Temperatures below 55 degrees and above 80 degrees may cause the medication to lose effectiveness. It is important to be especially mindful of freezing temperatures, as the medication is liquid and if frozen will not be able to be administered. Limited, accidental exposure to heat or cold is okay. This is why it's not recommended to keep naloxone in a vehicle, but we encourage you to ask what your department's policies are. Naloxone comes in several forms with different routes of administration, including intravenously or via IV, an injectable or intramuscular form, and a nasal spray. This slide will focus on the nasal spray and intramuscular injectable forms of naloxone. The nasal spray form of naloxone is what is most commonly used by laypersons and community members. The needle-free device requires no assembly and is easy to administer in a person's nostril without any formal training. The most common brand name of nasal spray naloxone is Narcan, and the 2 terms may be used interchangeably at times. This training will focus only on the nasal spray form of naloxone, or Narcan, as this is the form the health department provides to public safety partners. Naloxone may also be administered via an intramuscular injection, sometimes referred to as IM naloxone. This form of naloxone typically requires the dose to be drawn from a vial containing the medication. The dose is injected into a large muscle, like the outer thighs, and can be done through clothing if needed. Just like naloxone administered via nasal spray, intramuscular naloxone should take effect within 2 to 3 minutes, and additional doses can be given if needed to reverse an opioid overdose. Naloxone works by knocking opioids off their receptors in the brain and taking their place. This temporarily prevents the opioids from connecting to the receptors and takes away the high, and most importantly, gives the person a chance to breathe. This is naloxone's only function. If someone does not have opioids in their system and is given naloxone, there will be no effect. This is why we always encourage people to use naloxone if they have any suspicion that someone is overdosing on opioids. If there are other substances in someone's system, naloxone will only have an effect on the opioids they have taken. When in doubt, it is best to administer naloxone. Naloxone is safe for everyone, including people who are pregnant, children of all ages, and even pets. Naloxone cannot be abused and it cannot cause an overdose. It is a very safe medication with only one purpose: to kick opioids off the receptors in the brain and restore breathing. If naloxone is given to a person not currently overdosing on opioids, there will be no effect. It's important to know that naloxone cannot be self-administered. If someone is requesting naloxone, they do not need it in that moment for an overdose. But as we've discussed, people can slip into an overdose quickly, so it's best to keep a close eye on them. When given to a person who is physically dependent on opioids, naloxone may cause sudden withdrawal symptoms such as nausea, vomiting, diarrhea, chills, muscle soreness, and changes to mood or mental status, like confusion, disorientation, and even agitation. Finally, each nasal spray cartridge only contains 1 dose of the medication, so it's important to never spray a test dose before using. Now we will review how to respond to an opioid overdose with naloxone. Remember the 4 R's: recognize, respond, reverse, and refer. The first 2 R's are recognize and respond. First, you should look for the signs of an overdose. Is the person breathing or struggling to breathe? Are they making gasping or gurgling noises? Are they responsive to noise or physical stimuli? Does their skin, particularly their lips and fingertips, appear discolored? Next, look for any helpful information on the scene. This may include reports from witnesses, a known history of drug use or previous overdoses, drugs or supplies present on the scene, or asking whether naloxone has been used prior to your arrival. As part of your assessment, approach the individual and loudly ask if they are okay, and provide an uncomfortable physical stimulus, either by shaking them or rubbing your knuckles on their sternum. If they do not react, it is time to respond. To administer naloxone, peel open the package, place the tip of the nozzle into the nose until your fingers touch their nose, and firmly press the plunger to dispense the medication. Remember that each dispenser has just one dose, so be careful to only press the plunger once you're ready to use it. Naloxone enters the bloodstream by absorbing through the lining of the nose. A person does not need to be breathing or inhale for the medication to be effective. After administering naloxone, there are several more important steps you can provide when responding to an opioid overdose. First, you can provide rescue breaths to help deliver more oxygen to the individual. To perform rescue breaths, tilt the person's forehead back gently with the palm of your hand and lift their chin up with 2 fingers to ensure their airway is open. Pinch their nose and seal your mouth over their mouth and blow steadily and firmly into their mouth for about 1 second. Look to make sure you see their chest rise and fall. You will want to deliver a breath every 5 to 6 seconds. If you are trained, provide CPR if you determine that it is needed. If the individual is not breathing after 3 minutes since you first gave them naloxone, you will need to give them another dose. Depending on the amount and type of opioid a person has taken, additional doses of naloxone may be required. Give the second dose in the opposite nostril from the first dose. You can repeat additional doses every 3 minutes until the person begins breathing again. Continue either rescue breaths or CPR if you are trained and determined that it is still needed. If the person starts breathing on their own but does not wake up, roll them into the recovery position like you see in this image, where they are on their side with one arm bent up and out, the other under their head, and the top leg bent. This position keeps them on their side and prevents them from choking if they vomit. Be prepared for withdrawal symptoms, and most importantly, try not to leave the person alone until medical help arrives. Naloxone may trigger sudden withdrawal symptoms for individuals who have been using opioids, particularly those who are physically dependent. Upon waking up, be prepared for any of the following symptoms: nausea and/or vomiting, muscle aches, diarrhea, disorientation or confusion, chills, and mental or mood-related symptoms such as anxiety, agitation, irritability, or combativeness. The person who overdosed likely will not remember what happened. They may be scared, nervous, restless, agitated, or combative. Be prepared for a variety of reactions. Use your best judgment in the situation, and if you deem appropriate, give them space after you've administered Narcan. Try to keep them calm until medical transport arrives. Opioid withdrawal can be incredibly painful, and some people may want to immediately resume use to alleviate their symptoms. If you are able to, try to stop them from taking any more drugs. The final R is refer. Even after administering naloxone, it is best for people who have overdosed to receive additional medical care. This is in part because naloxone is a temporary medication and will wear off over the next 30 to 90 minutes after given. Depending on the individual and amount of opioids taken, it is possible for them to slip back into an overdose as naloxone wears off. If the individual agrees, have them transported to the nearest medical center. Additionally, further medical assessment can help connect the individual to treatment and recovery options if they are interested. Know that not everyone will agree or want to be transported for additional medical care. However, by responding to their overdose promptly and with naloxone, you have helped give them another day. Washington State's Recovery Helpline is a great resource for individuals seeking guidance and support related to mental health, substance use, and problem gambling. Finally, responding to an overdose is traumatic for all involved. It is important to take care of yourself and reach out to others for support. Before we finish, let's review what we've discussed today. When responding to a potential opioid overdose, you first want to look for the signs and symptoms of an overdose. These include irregular breathing or not breathing at all, unresponsiveness, gasping or gurgling noises, a very slow pulse or no pulse, and discolored skin. After observing these signs, the next step is to approach the individual and assess their responsiveness by providing both verbal and physical stimuli. It is recommended to try shaking the individual or rub your knuckles along their sternum. If the individual does not respond to your verbal or physical stimuli, it is time to take action by administering the first dose of naloxone. After giving the first dose of naloxone, start a timer for the next 2 to 3 minutes. If the person does not start breathing after 3 minutes, give them a second dose of naloxone in the opposite nostril. Between doses of naloxone, you can provide additional support by providing either rescue breaths or CPR if you are trained and determined that either are needed, or by moving the individual into the recovery position in case they get sick and vomit. You may continue giving additional doses of naloxone every 2 to 3 minutes until the person starts to breathe. As naloxone takes effect, the individual may experience sudden withdrawal symptoms. You should be prepared for a variety of physical symptoms such as vomiting, diarrhea, chills, and aches, as well as mental and emotional symptoms that may include anxiety, agitation, or even combativeness. Continue providing support in a way that keeps yourself safe and try to stay with the individual until medical help arrives to provide further care. You are now trained to administer naloxone and help prevent future opioid overdoses. We hope that you found this training helpful and informative. Please reach out to Brenna Smith at brenna.smith@co.snohomish.wa.us with any questions, or contact the Snohomish County Health Department's opioids team by email at shd-opioids@co.snohomish.wa.us.